is a project on plantar fasciitis, and we need to know what the plantar fascia is, and that's that little band right there that starts at the calcaneus and attaches to the metatarsal bones or the beginning of your toes. And the way I like to look at it is it's like your foot is the bow and the strand is the fascia. It allows you to keep that arch in the same way the fascia would. In aids, it supports the arch of the foot, and all those tiny bones in the foot are supported by this band to let the foot absorb the shock when walking and lets us move the way we do. Now, plantar fasciitis is when that fascia is put into overuse, so it becomes inflamed, which typically is from tight calves. So you can see up there the Achilles tendon. If a tight calf would be pulling that tendon up, it would pull the calcaneus up as well, stressing the heel portion of the plantar fascia right there, where it starts at the calcaneus. And you'll know you'll have this potentially if there's a sharp pain in your heel, especially when you're walking or running. When you step out of bed, or typically in a plantar flexed position, because when we're resting. So when we get out of bed, you'll know you have inflamed plantar fascia when you have really sharp pain in your heel just getting out of bed. Sometimes if it's intense enough, there's some swelling in the foot. This is since it's an overuse injury, any activity involving running for long periods of time are susceptible to this. I've seen it in football. It could be in soccer, basketball, anything with running. And if you feel it coming, or you feel it like it just happened recently, it'd be good to ice it. Try massaging it with the ball, rolling it over, and since it is an inflammatory response, some have taken anti-inflammatories to try to relieve the pain and swelling. If those don't work in a more chronic setting, shockwave therapy has been found to reduce pain for a little bit and promote healing. And the idea is to help loosen up the area to relieve the pain. And there could be some collagen that's formed from just being stiff, or no, rather the stretching and forming scar tissue. And more invasive treatments, if those don't work, are the corticosteroid injection to just remove the inflammation, relieve pain, or plasma therapy using your own blood and injecting it, taking it from a different site, putting it into the foot site to promote healing in that way. And in the physical therapy sense, this would be before all those, you'd want to stretch the gastroc soleus complex as much as you can, since that's like one of the pulling factors of the calcaneus and stress points. We would look at how you would walk and how your footwear is. Sorry about that. So, for example, how you're striking when you're running. So if you're a heel striker, it's more likely that you're putting stress in the fascia, because when you're striking in the heel, your toes are already up, so there's some stretch right there. So the fascia in that strike is already stretched as far as you can. So if you think about that happening often, there's cause to the inflammation in the area, just irritating it constantly. And then from there, you would try to loosen it up first, and then addressing muscle deficiencies or any impairments in, like, let's say their balance, to see how their arch strength is. So a bunch of arch support exercises would be suggested to try it out. Towel scrunches are a really easy way to get into the arch support exercises to get more advanced. For example, we would do single leg RDLs. You want to make it even harder, you could put a band under it to really emphasize toe down and forming the strongest arch you can, while having variable change in your weight, like position. Taping can be used to support that arch. I've seen it in our clinic with a football player who is suspected to have plantar fasciitis. He has a lot of pain in his heel, and well, he plays football, so he runs a lot. And we actually taped him up once before his practice or his game like that, and he said it helped, but in his follow-up appointment, he came in and it was hurting again. So it was it was pretty temporary for what it was, and but the tape job was to support his arch, and he did have a feeling of looseness or support, like less tension in the bottom of his sole, and it's supposed to prevent excessive pronation to stretch that would stress the fascia. So the main takeaways of this would be to uh, check your footwear first, or just look at a bunch of pathways before the invasive treatments. So trying out different footwear and trying to see like where things could be going wrong. Going to podiatrist would be the best bet because they're going to evaluate the way you're walking and how your foot just kind of interacts with the world and possibly give you an insole that works best for your fascia. Stretching often wouldn't hurt anybody. Anyone can do it. You can do it anywhere. You could just stretch your calf, making sure that that component wouldn't affect your fascia. And so tape is temporary. I would like to say that tape is encompassing most of the treatments here, because through my research I got to see that all of these were pretty temporary in terms of treatment. Even having tape mixed in with shock therapy, there was a study found that they were able to find pain relief, but the relief did not last that long. It lasted for a few weeks. And biomechanics are for life, so addressing the way you move right now and trying to fix those in order to uh, fix your, or maintain your fascia and take care of it, is going to be good to address and try to improve on. That's it.